DMPA is a very important form of injectable contraception. When to use DMPA, how long DMPA gives protection from pregnancy or as a contraceptive method, what are the side effects of DMPA, does DMPA cause weight loss, does DMPA cause infertility, what are the other uses of DMPA. Good morning, I am Dr. Rajat and you have started watching our YouTube channel, The Fertility Gynecologist. Today in this video we will discuss everything you want to know about DMPA. So what is DMPA? Is DMPA and ANTARA the same? DMPA is basically a depo-medroxyprogesterone acetate. So short form of depo-medroxyprogesterone acetate is called as DMPA or DMPA as some people may call it. Depo means when it is a fat-based injection, lipid globules, combination of lipid globules, when it is injected in the intramuscularly, the injection, the medroxyprogesterone acetate is released slowly. And depo means the action is there for a longer period of time, for about 3 months, 88 to 90 days to be precise. ANTARA is the injection of form of DMPA which is given by the government of India for prevention of pregnancy or as a contraceptive measure. How does DMPA work? Now, again, in my previous videos I mentioned how, first of all, before understanding the mechanism of DMPA, you have to understand how does the pregnancy occur. From vagina, the semen is deposited in the vagina, the sperm goes up, sperm goes through the cornua to the fallopian tube. From ovulation, the follicle gets picked up by the fallopian tube and the fertilization of sperm and ova occurs in the fallopian tube. From fallopian tube, the embryo comes and gets implanted in the uterus and for in the endometrium, and for the implantation to occur, the endometrium has to be prepared. It has to be of a good thickness endometrium. Any kind of progesterone, what it does is, it in a previously prepared endometrium, that means estrogen primed endometrium, if progesterone is given, then that may help for the pregnancy. But if progesterone is given in high doses, progesterone is given in depo form, it dries cervical mucus. So the moment the cervical mucus is dry, the natural pathway of the sperm to the cervix and to the uterus may not occur, and it also thins the endometrium. It basically creates excessive changes in the endometrium, secretory changes in the endometrium becomes excessively thin, and as a result the pregnancy may not occur. So this is how the DMPA works. DMPA is also called as a LARC, that is long acting reversible contraception. Why it is reversible? Because after 3 months the action of DMPA starts decreasing, and by the 4th month most of the patients can conceive naturally, and it is reversible in a sense. It is not like permanent action like tubal ligation or vasectomy. That is why it is called as a long acting reversible contraceptive. How the DMPA is given? The DMPA injection is basically given deep intramuscularly. It is usually given every 3 months. And the maximum dose of DMPA can be given is for 2 or maximum 3 years, not more than that. Why DMPA should not be given more than 3 years? I'll come to it in the later part of the video. How to give DMPA? It is given as a deep intramuscular in buttocks especially. It is to be alternated. Say if you have given once on right side, then next time the injection should be given on the left side. Can DMPA cause fertility issues? Like I said, because it is an anti-fertility medicine, it is a contraceptive medicine, it basically thins the endometrium and dries the cervical mucus, and if it is given for a 2 to 3 year period, then the reversal of actions may take about 3 to 4 months, but the research has found out that DMPA is a reversible contraceptive. Meaning of reversible contraceptive is that it does not cause permanent infertility. The return of fertility may be delayed by a couple of months after the last injection of DMPA, but that does not mean that it causes infertility. Does DMPA prevent ovulation? To some extent, yes, it may prevent ovulation, but not always. Because for prevention of ovulation, estrogen is required, and estrogen and progesterone combination is there in combined oral contraceptive pills. And that is why they prevent ovulation more effectively than DMPA. And that is why if DMPA is given after ovulation, then there are chances that, and patient has had intercourse in that cycle, then there are chances that patient may conceive. That is why whenever we give DMPA, this is our policy at our clinic, first of all we need to give DMPA at day 1, day 2, day 3 of cycle. We always make sure to do a transvaginal ultrasound before giving DMPA. If for some reason patient has come in the middle of cycle and ovulation has occurred, endometrium is thin, there is a free fluid, and patient has had intercourse, then we are sure that patient may not come back again, or patient is living outstate or far away, that patient may not come back again after the cycle, then we may give DMPA with a caveat that if the period is missed, then there may be chances of pregnancy. And if there is a chances of pregnancy, patient does not have the period within 5 to 7 days, then she should come for checkup or do a ultra urine pregnancy test or a transvaginal ultrasound. Because if the patient has had intercourse before ovulation and we give injection after ovulation, it may on the contrary act as a luteal phase support kind of thing, and if the pregnancy occurs, patient may perceive it to be a failure of DMPA, which otherwise is not the failure of DMPA. It is the incorrect timing which has been given, and that is why DMPA should always be given on the first, second or third day. Now the action of DMPA does not start second day after giving the injection, because it is a depot preparation. To reach the peak concentration level, it needs about 7 to 10 days. So whenever we are giving a DMPA injection, especially for the first time, we tell our patients if they have a sexual intercourse in next 7 to 10 days, at least use another method of contraception, preferably a barrier method of contraception. If we are using DMPA continuously, say I have given one injection today, another injection I have given 90 days later, then there is no need to use a double method of protection. But if suppose patient was due to come after 3 months and patient comes 10 days after that, then again we have to follow the same protocol that I am giving the injection today, do an ultrasound, give the injection, and for the next 10 days, if the patient has an intercourse, tell her to use a barrier method of contraception. This is very, very important. What are the advantages of DMPA? Like I said, DMPA is a long-acting reversible contraceptive. It needs to be used only once in 3 months. That means only 4 times in a year, and that is reasonable enough. This thing, because the patient doesn't, the compliance is excellent. Are there any side effects of DMPA? Now, this is the most important burning question. In most of the females, there is a weight gain which occurs after DMPA, and there are irregular periods or amenorrhea after DMPA. And last and most important side effect is osteoporosis occurs after the long-term usage of DMPA, and that is why we do not use DMPA for more than 2 to 3 years. And even when the patient is on DMPA, we add calcium plus vitamin D combination to prevent the osteoporosis. Now we'll come to each side effect one by one. Weight gain. Progesterone basically causes the fluid retention in the body. Even in a natural cycle, the second half of the cycle after ovulation till the periods, there is an increase in fluid retention in the body. As a result, there is a weight gain of 1 to 2 kgs, and that weight gain is lost, or the patient loses that weight because of the fluid retention the moment she gets her period. The same mechanism occurs in DMPA, but it occurs for a longer period of time. So the weight gain is because of DMPA is not more than 2 to 3 kgs over a period of time. But like I've said in my multiple videos, why most of the females after a successful contraception or a family planning operation gain weight. See, there was a study done in which they found out that the moment the patient has a fear that she may conceive anytime, she is not using any contraception method, or she has not got a permanent tubal ligation or a permanent family planning operation, and they are living in some kind of fear. And because of that fear, they eat relatively less, and that is why they do not put on the weight. But the moment a good contraception is used, either in form of oral contraceptive pill, or in form of copper T, or in form of DMPA, or in form of a tubal ligation operation, then they become happy. Then they are relatively carefree, that pregnancy may not occur, and the quantity of diet relatively increases, and as a result the weight gain occurs. The weight gain of couple of kgs is fine with DMPA, but more than couple of kgs it may boil down to the lifestyle factors and the diet of the female. So DMPA does not lead to the weight gain more than 2 to 3 kgs. As far as irregular menses is concerned, yes, DMPA does cause irregular menses. Females may get menses once in every 1.5 months, 2 months, 3 months. Some may not get menses for 6 to 8 months also. Again, it depends on their condition. If patient is having a polycystic ovary, that may further delay the worsen the menses. If patient is nearing her menopause, or she already has a decreased ovarian reserve, decreased AMH at the time of DMPA, that may also have an effect on menses. But the more standard quality DMPA is there, the more chances of amenorrhea is there, and that's what we want. We want the patient should not get menses, so the chances of pregnancy decrease dramatically. But if for some reason females who desires contraception, they want that females they should be getting regular periods, then DMPA is not for them. We especially prefer DMPA to the lactating females who already have irregular menses. We especially prefer DMPA for the females who are having menorrhagia from some other cause, heavy menstrual bleeding. In those cases, DMPA may not only cure menorrhagia or control menorrhagia, but it may also act as a contraceptive measure. And last and most important, osteoporosis. Prolonged use of DMPA leads to the thinning of bones, thereby increasing the risk of fracture, and that is why we do not give for more than 2 to 3 years, maximum 3 years. And also along with DMPA, we advise females to take routine calcium and vitamin D supplementation, and also do some kind of strength training or walking. Does DMPA protect against sexually transmitted infection? Answer is yes and no also. See, sexually transmitted infection occurs because of the unprotected intercourse without using a barrier method of contraception. The moment the semen gets deposited into the vagina, infection may occur from semen to the vagina, but it may not go up because DMPA has already made the cervical mucus thick and the semen may not go up, so ascending infection may not be there. But vaginal infection may occur. So, although it decreases the risk of a pelvic inflammatory disease, but the vaginitis and the cervicitis may occur if the unprotected intercourse is done. Why? What can one start DMPA at any time? If you are not sure that patient may not turn up after 15 days after menses, then it is better to give DMPA anytime the patient comes for the first time. If the ovulation has already occurred, that we may advise patient that she should come back again after 15 to 17 days or do a urinary pregnancy test and come as soon as possible if the urinary pregnancy test is possible, so that the medical termination of pregnancy by pills can be done. If patient is not living with her husband, then the answer is definitely sure, we can give her anytime, with a caveat that if within the next 10 days they have an intercourse, then she should use an additional method of contraception. But if patient is living with her husband and she can come after periods, then the best time to give DMPA is on day 1, day 2 or day 3 of menses. If patient, even if the patient has come on day 8, day 9 of menses, we may give DMPA with a caveat to see the patient again after 1 month, just to rule out the early pregnancy, because by day 7, day 8 already follicles may have started forming, and if somebody has an intercourse before that time, the pregnancy may occur. This is a very, very important point which needs to be taken into account. What if one misses the scheduled injection? Suppose patient was to come on 30th of the month and she got an injection 3 months before that. If patient misses, we may repeat the injection as soon as she comes. Again, we will tell that the effect of injection may not occur immediately the next day. If she happens to have intercourse in next 7 to 10 days, she should use the additional method of contraception and she should follow the rigorous schedule. See, 1 or 2 days missing is not an issue, but the moment the female misses by 7 to 10 days, then the concentration of the medroxyprogesterone acetate in the body goes down. Does it cause bone loss? Yes, longer form of the DMPA does definitely cause bone loss, and that is why it is to be given for a period of 2 to maximum 3 years only. What if somebody on DMPA wants to become pregnant? We advise whenever the female and male and her partner, they are mentally prepared for pregnancy, they should visit at least 3 months before planning the pregnancy. And we may not give the another injection of DMPA, and we give them a folic acid and vitamin B12 supplementation. We also give them a calcium and vitamin D supplementation. And we advise them to follow healthy lifestyle and good diet, and then plan the pregnancy after 3 months. What is the best time to DMPA? Day 1, day 2, day 3 of the cycle of a spontaneous or induced cycle is the best time. Patient is lactating, it can be given at any point of time. When should DMPA not be given? For any females who are already on steroids for some causes, they may already have osteoporosis. For females who want regular periods, they do not require or they may not want DMPA. Is DMPA safe for breastfeeding? In fact, it is an excellent molecule as a method of contraception for breastfeeding, because breastfeeding would already have irregular periods. Some females with breastfeeding may have menorrhagia. So not only it will protect from menorrhagia, it will induce the amenorrhea, it will also, and females do not want regular periods at that point of time. So it is the best molecule, and females are more receptive during the time of pregnancy. They are already taking calcium, vitamin D supplementation. So for lactating females, in fact, for 1 year, DMPA should be the first molecule which should be preferred, even above copper T. That is my personal belief. Does DMPA cause weight gain? Again, I have discussed earlier in the video. The progesterone molecule basically causes fluid retention. Because of that fluid retention, 1 to 2 kg of weight gain occurs. Because that progesterone is there in the body for the longer time, the more fluid retention occurs. As a result, there is an increased sense of bloating, increased sense of abdominal distension, increased sense of breast heaviness in the females, and that is why it causes a couple of kgs of weight gain. But fluid retention will not cause 7 to 10 kgs of weight gain. 7 to 10 kgs of weight gain which occurs in the females with DMPA because of the poor lifestyle and excessive or a improper diet. If female is following a good, healthy, rigorous lifestyle and diet, then there are chances that weight gain may not be much. What is breakthrough bleeding? Now, in females in which only progesterone is there, it sometimes leads to the excessive secretory endometrium, and because of the absence of estrogen, sometimes the endometrium breaks and it causes sometimes some spotting, some bleeding, and that is called as breakthrough bleeding, which is present in some females of DMPA, and because of that there is a irregular menses. What is the age limit of DMPA? Ideally, I would give DMPA to females who are less than 30-35, but like I mentioned before in the video, some females around 35-40, they come with menorrhagia. They have also not gotten a family planning operation done. So for menorrhagia, for heavy menstrual bleeding, either because of adenomyosis or because of fibroid, we may give DMPA as an injection to control heavy menstrual bleeding. It may not only control the heavy menstrual bleeding, it may also induce the amenorrhea, and it may also act as a contraceptive method because females can conceive till 41, 42, 43, 44, 45. So it is best we can give DMPA, but we do not continue DMPA for long. And also in that age group, it is better if we give calcium and vitamin D supplementation. What causes depot to fail? I mentioned again in my video, if patient's LMP was say 14 days back, she has had ovulation couple of days before, and in last 7 to 10 days she has had an intercourse, and we give the DMPA injection after ovulation, then in those cases it is a likelihood that female may already have fertilized the egg before coming to us. And if we give DMPA, the giving of the DMPA would rather act as a luteal phase support. It may support the pregnancy, and that may cause the pregnancy to occur, and that may in female's eyes, in the patient's eyes, they may think that this is a failure of DMPA, which in fact technically it is not a failure of DMPA. It is actually a improper timing at which the DMPA was given. So correct timing of DMPA is very, very important. We can also use DMPA in cases of dysmenorrhea in around 35-40-year-old females. Dysmenorrhea in most of the cases is because of excessive progesterone secretion in the luteal phase. So it may reduce DMPA, especially if it is because of endometriosis, especially if it is because of adenomyosis, because the treatment of endometriosis and adenomyosis is we have to give progesterone hormone to counteract the effect of excessive estrogen. So DMPA can also be used in heavy menstrual bleeding. It can also be used in adenomyosis, dysmenorrhea. It can also be used in chocolate cyst. But like I mentioned, there are better drugs available. There are better molecules available which have greater efficacy and better return on investment kind of thing. Dinogest is available, letrozole is available, GnRH agonists are available for adenomyosis, for endometriosis. So we have to do a balancing act as far as what are the symptoms, what is the age, how long does the patient want that particular therapy for that particular disease. But having said that, carry home message would be for all the breastfeeding and the lactating females, the moment they are in the hospital, they should be given DMPA, they should be counseled, because anyway they are going to take calcium for at least a year. And what we have found that immediate post-delivery, 2 to 3 months after delivery, most of the females are hyperfertile and they come to us with a pregnancy within 6 to 8 months of delivery. So if DMPA has been given, that unwanted pregnancy may be avoided. It can be given to females who may not be compliant with oral contraceptive pill, or for females whose IQ is low, who may not be taking oral contraceptive pills for long, or in females who may not desire regular menses, then those females can be given DMPA for 2 years. But the best part of DMPA is utilized in a pregnant patient or a delivery patient who is breastfeeding. Hope you like the video. For any more questions on the DMPA, kindly comment to us. Please share the video and subscribe to our channel. Namaskar. Bye bye.